Radio Health Journal talks about how doctors can learn to communicate better after this.
Remember the days when we used to make macaroni art for Mom or regift items found around the house for Mother's Day? This year, show Mom how much you appreciate her and all that she does with flowers from Pro Flowers. Pro Flowers is offering listeners 100 blooms with a free glass vase for just $19.99. Or make her day extra special and upgrade to a premium vase and add chocolates for just $9.99 more. Go to proflowers.com today and use my code RHJ. Their easy-to-use website makes buying a beautiful gift for Mom simple and quick. Pro Flowers are guaranteed to be fresh and beautiful for at least 7 days. You just choose the delivery date you want, and it's guaranteed. Here is the only way to get 100 blooms with a free glass vase for just $19.99. Visit proflowers.com. Click on the blue microphone in the top right corner and type in RHJ. That's proflowers.com. Click on the microphone and type in RHJ. Order today. This offer expires Friday at midnight.
If your doctor told you you needed an end-to-end anastomosis, you'd probably shake your head and say, huh? Unfortunately, it happens all the time. Doctors and scientists have a bad habit of using jargon we normal people can't understand, even though it's not good for patients or for getting funding for scientific research. Actor Alda had to say some of those indecipherable terms back in the 1970s and early 80s when he played an army surgeon on the hit TV series MASH. And almost ever since, he's been on a mission to get doctors and scientists to speak in terms we can all understand without leaving accuracy behind. He's finally found a partner in the Stony Brook University Center for Communicating Science.
It's the first of its kind with the mission of teaching scientists and healthcare professionals to be more effective communicators with the public, with their patients, with the media. And we do this through teaching them improvisation and other tools, how to effectively communicate by distilling their message. And we also teach them how to use digital media and other tools to get their message out to the public.
That's Dr. Yvonne Kaplan-Liss, Associate Professor of Preventive Medicine at Stony Brook University and Director of the Advanced Graduate Certificate in Health Communications. Part of the program is an elective 6-week course where med students participate in improvisation workshops, some led by Alda himself.
Physicians are trained to be empathetic and to communicate with their patients with language, but they're not often trained to understand their patients through body language.
Truth be told, the first improv experience, I was really nervous and I was kind of hesitant and I didn't think it was important. I was like, why are we doing this? This is a waste of time. We should be sitting down, reading scientific papers and figuring out how to translate them to the normal people.
That's Ashwin Malhotra, who as a first-year medical student at Stony Brook University School of Medicine participated in the Alda improv workshop.
But then as the session progressed, within like 30, 45 minutes, I saw the power of improv. I was like, oh, wow. I'm not enjoying it because I'm struggling, because I'm not a good communicator. I'm having a very hard time expressing what I want to say with my body language. I'm having a very hard time trying to guess what this person's trying to say, and I'm having a very hard time just following directions without having it rehearsed or pre-scripted.
Malhotra says improvisation workshops are a lot different than the traditional clinical simulations offered by most medical schools, where trained actors play the part of patients in a very scripted role.
When we ask them a question like, what brings you in today? How are you feeling? Where does it hurt? They know exactly what to say. They know exactly the one-word answer, two-word answer that they're programmed to say. If we ever don't understand something that we're explaining to them, we just kind of move on. But in these improv sessions, you're with another person. It's live. There's no script. And I was playing doctor. Another student was playing a patient. We just sat down and started a conversation. And in the medical school simulations, we're more focused on asking the right questions in the right order to get a history or do the physical exam. In these improv sessions for communicating science, it was different. We weren't focused on asking the right questions or the right order. We're more focused on the tone in which we were asking the question.
And unlike what occurs in most clinical simulations, people who are role-playing the patient during improvisations are free to ask the doctor questions.
Let's say someone comes in with abdominal pain and you start asking them, how are they sleeping? And the standardized patient is just going to answer you. But in communicating science, the role-play students are like, why are you asking me about my sleeping patterns when I have pain in my stomach? It's disconnected. So just explaining that Because as a physician or as a future physician, we're trained to connect the two, and we're trained to just ask pertinent positive, pertinent negative questions to kind of figure out what's going on with them. But the patients might not understand why we're asking such esoteric questions or disconnected questions.
In his first improvisation experience, Malhotra had to play a physician to a young female patient with heartburn. Kaplan-Liss watched the exchange.
When he walked into the room, he went right to wash his hands, because that's what they teach you in medical school, always wash your hands. It's very funny. Medical schools are very rote, you know what I mean? Like told to do something and they do it. So he's told always to wash your hands, but he walked into the room and in a fake setting washed his hands, but didn't even eyeball the patient when he walked in the room. So we picked up on that through the improv. It was interesting.
One of the critiques that I got was I seemed distant as a physician. The way I was sitting a little further back. I was very rigid and seemed a little intimidating to the patient. I could have been a little bit more comforting, sat a little closer, and I seemed very to the point, just wanted to move on to the next question, trying to figure out what's going on with her, what's wrong with her condition. I didn't spend enough time on her occupation or how's her social life or the other questions that are very important in medical history.
Okay, fixing those problems might help a doctor connect with a patient, but physicians don't have all day to spend with us in the exam room. So isn't this approach a little impractical?
I would say this improv session absolutely helps you in a way to establish that rapport, that level of trust in a quicker fashion, actually. What this improv session really taught me is you go in, you introduce yourself, just don't shake their hand, tell them that, hey, if it's okay with you, I'm going to go wash my hands first, and then really get started. And then typically when we open an interview, it takes 30 seconds, not even 10 seconds, to say to the patient, hey, listen, before we begin this interview or the physical exam, I just want to let you know that everything we talk about is confidential. Please feel comfortable to discuss anything with me, and please interrupt me if you have any questions. Just those two sentences establishes a very powerful relationship with the patient from the get-go. The biggest challenge of history taking is the patients are withholding information. They feel uncomfortable discussing certain things, or certain things are just not something that they talk about. Like no one wants to discuss diarrhea, but it's a very important part of the medical history. So if you have a good relationship they feel comfortable with, you'll make the rest of the history taking very easy.
But according to some doctors who've been in practice for years, not all patients are mystified by medical jargon. Some patients actually prefer it.
Some people can be very familiar with medical lingo. If they're unfortunately sick or have been sick for a while, they have family members who are sick, people can learn the language. So that's one way of doing it. Patients sometimes feel familiar with the language, and they want doctors to use that language because they don't want to feel like they're being talked down to.
That's Dr. Zach Berger, Assistant Professor of Medicine at Johns Hopkins University and author of the book Talking to Your Doctor, A Patient's Guide to Communication in the Exam Room and Beyond.
In some cases, there are probably people that a certain obscurity or a certain remove makes them more comfortable. It makes them feel like the doctor knows what they're talking about. So I think that's definitely the case. And, it's not just explaining things in simple language. It's figuring out what the patient knows walking into the room, what they're hoping to hear, what their expectations are, what their needs are, and then communicating in that direction. The way a doctor helps a patient understand something should really depend on where the patient is coming from, the context that the person comes from.
Today, doctors need to straddle two worlds. We expect them to be knowledgeable about what's wrong with us, but we want them to be comforting and people-oriented too. It's a tall order, but Alda believes it's well within reach. With attention and practice, even the geeky medical nerd can become a better listener, a better communicator, and a better doctor. Our writer this week is Polly Hansen. Our production director is Sean Waldron. I'm Nancy Benson.
Ulcerative colitis is an inflammatory bowel disease affecting more than 1 in every 1,000 Americans and can severely impact a person. This Inflammatory Bowel Disease Month, learn more from gastroenterologist Dr. Patricia Raymond.
Ulcerative colitis typically has cycles of flare-ups and remission, but continuous management can reduce flare-ups and help maintain remission. Adding a medical food probiotic like VSL number 3 to traditional therapies can help. In fact, a recent study showed adding VSL number 3 was found to help maintain remission in ulcerative colitis.
VSL number 3 is at least 10 times more potent than the average probiotic and clinically proven in the dietary management of ulcerative colitis, ileal pouch, and IBS. VSL number 3 differs from other probiotics in that it is a medical food and must be used under medical supervision, so ask your doctor about it. VSL number 3 products are kept refrigerated behind the pharmacy counter. Learn more at vsl3.com.
Times sure have changed since Geico started saving people money over 75 years ago. We didn't have video games like today, but that's not to say we didn't have fun. One of my favorite games was Don't Get Kicked by the Goat. Now that's some real excitement, especially when someone lost. Yep, back then we knew two things: how to have a good time, and that Geico was always a good deal.
Geico, saving people money on car insurance for over 75 years.